Imagine finally getting a good night of sleep because you no longer have to wake up 5 times to use the bathroom. Imagine standing at the urinal and having a strong, steady stream just like you did in your 30s. That sounds like a dream come true for millions of men dealing with an enlarged prostate. But now imagine the cost of that relief. Imagine being intimate with your partner, reaching the climax, feeling the sensation of an orgasm, but absolutely nothing comes out. This is called a dry orgasm, or medically known as retrograde ejaculation, and it is the single most common secret side effect of standard prostate surgeries. For many men, this feels like a loss of their manhood, but I am here to tell you that it does not have to be this way. There are modern approaches and specific questions you must ask your doctor to ensure you fix your urinary flow without sacrificing your sexual function. I am Dr. Sarah Mitchell, and today we are going to have an honest, grown-up conversation about your prostate, your surgery options, and how to protect your ejaculation. To understand how to avoid the problem, we first have to understand what is happening inside your body. Most men do not realize that the prostate is not just a muscle that blocks urine. It is a gland the size of a walnut that sits right below your bladder. Its main job is to produce prostatic fluid, which makes up about 30% of the volume of your semen. The rest comes from the seminal vesicles, and only about 1% actually comes from the testicles. This fluid is rich in zinc, enzymes, and citric acid, all designed to keep sperm alive. When you ejaculate, a very complex coordination happens. It has 2 phases. First is the emission phase, where all these fluids gather in the urethra. Then comes the expulsion phase. This is the critical part. For semen to shoot forward and out of your body, the neck of your bladder, which is the internal sphincter, must close tight. At the same time, the muscles in your pelvic floor contract to push the fluid out. Think of it like a pressure valve. If the back door is closed, the only way is out the front door. Here is where the problem starts with standard prostate surgeries. When you have benign prostatic hyperplasia, or BPH, your prostate grows and squeezes the urethra, blocking the flow of urine. The gold standard surgery for decades has been something called TURP, or transurethral resection of the prostate. In this surgery, the doctor goes in and scrapes away the inner part of the prostate to widen the channel. It is like coring an apple. It works great for urination because it removes the obstruction. However, in doing so, it often damages or removes the internal sphincter mechanism at the bladder neck. When that bladder neck is compromised, it can no longer close tightly during orgasm. So, when you reach the peak and your muscles contract, the semen takes the path of least resistance. Instead of shooting out the tip of the penis, it flows backward into the bladder. This is retrograde ejaculation. It is not dangerous physically. The semen just mixes with your urine and you pee it out later. But psychologically, it can be devastating. You still have the orgasm, you still have the sensation, but the visual confirmation and the physical release of fluid are gone. For many men, this comes as a total shock because their surgeon might have glossed over it as a minor side effect. But if you value your fertility or just the normal experience of sex, it is not minor at all. And this is why we need to talk about the alternatives. The goal of the procedure with zero ejaculation problems is to relieve the pressure on the urethra without cutting into or destroying that critical bladder neck sphincter. In the world of modern urology, we are moving away from the scrape and remove mentality toward techniques that preserve your anatomy. While standard surgery removes the tissue, newer minimally invasive procedures aim to simply move the tissue out of the way or shrink it without damaging the surrounding structures. By leaving the bladder neck intact, the internal sphincter can still close during sex, ensuring that semen goes forward, not backward. This distinction is crucial because not all prostate surgeries are the same. If you are dealing with prostate cancer, the situation is different. In that case, a radical prostatectomy is often performed, which removes the entire prostate gland and the seminal vesicles. When the whole gland is gone, there is no fluid to ejaculate because the organs producing it are removed. That causes a total loss of ejaculation, which is different from retrograde ejaculation. But for the vast majority of men watching this, you are dealing with benign enlargement, not cancer, so you have choices. Where are you watching this video from? I'd love to know. Please write it in the comments. I read them all and it helps me understand who I am talking to. It is fascinating to see how men from all over the world are taking charge of their health. Now, let's get back to how you can advocate for yourself. If your doctor suggests surgery for BPH, you need to ask a very specific question. Ask them, will this procedure affect my bladder neck? If the answer is yes, or if they mention a high risk of retrograde ejaculation, you should ask if you are a candidate for a bladder neck sparing technique or a minimally invasive option. There is also a lifestyle factor here that plays a huge role in how your prostate health develops. We know that obesity and excess body fat, especially around the belly and pubis, can hide the true size of the penis and complicate pelvic health. But more than that, keeping your weight in check and staying active helps regulate the inflammation that drives prostate growth in the first place. Men who are physically active have better blood flow to the pelvis, which supports both urinary and sexual function. It is also important to mention medications. Before surgery is even on the table, many men are prescribed alpha blockers like tamsulosin. These drugs work by relaxing the smooth muscle in the prostate and the bladder neck. While they are great for helping you pee because they chemically relax the bladder neck, they can also cause retrograde ejaculation while you are taking them. The difference is, with medication, the effect is reversible. If you stop the drug, the function usually returns. With standard surgery like TURP, the change to your anatomy is permanent. So the procedure with zero ejaculation problems is really about choosing the right intervention for your specific anatomy and priorities. It is about understanding that the prostate, the bladder, and your sexual organs are all part of a connected system. You cannot just treat one part without thinking about how it affects the others. Many men suffer in silence because they think these problems are just a natural part of aging or an unavoidable price to pay for medical treatment. That is simply not true. You do not have to trade your sex life for the ability to urinate comfortably. By understanding the mechanics of emission and expulsion and knowing that the bladder neck is the key to forward ejaculation, you are now armed with the knowledge to have a much more productive conversation with your urologist. Do not let embarrassment stop you from asking hard questions. Your sexual health is a vital part of your overall quality of life and your relationship. If a doctor dismisses your concerns about dry orgasms, find another doctor who listens. There are options out there that prioritize your function just as much as your symptom relief. I hope this information has been helpful to you. If you liked the video, please hit the like button and don't forget to subscribe to my channel. I'll see you in the next one. Take care.